All right, our second speaker for today's Sheep and Goat webinar is Dr. Denise Kenichi, who is serving as a small ruminant veterinarian at the University of Idaho. And she's graciously offered to talk to you guys about some of the sexually transmitted diseases and some of the considerations for culling during pre-breeding. So thank you so much for joining us, and I will let you take it from here.
Okay, thanks, Melinda. And again, yeah, my email is up there. So, feel free if at any time, if you have questions about any of this, or just sheep questions in general, I'm certainly happy to visit with people about disease issues. I'm a veterinarian. I spent quite a few years in a small rural practice, and then came to the U of I in 2017 and have been doing sheep work since. So today I'm going to give kind of an overview here. We'll talk about sexually transmitted diseases. Fortunately, there's not that many, so that's a good thing. So the majority of my talk will actually be looking at some of the considerations for culling our reproductive animals. Since mastitis, mammary issues tends to be the #1 problem that we see at the sheep center, it's kind of heavy on that aspect, but we'll also throw in a few other things, as well as we have to take the ram into consideration as well. And then I'll end with some biosecurity, just because I think that's an important area that doesn't oftentimes get thought of enough. So as I mentioned, the true venereal disease in our livestock animals, there's really actually only two, and that's the Vibrio venerealis and trichomoniasis, which in our sheep are generally not a huge problem, but there are certainly some other considerations where we can see diseases that can be transmitted in a sexual manner that are just good to think about or be aware of. In the case of the Campylobacter, and some of you may know this as Vibrio, the name got changed a few years back, but in the case of our sheep, it's generally prior to about 1980, it was the Vibrio fetus that was more of a problem, and past 1980, it's been more the jejuni, and that's more of an intestinal issue. And sheep can generally get that and expose it to each other through fecal oral or exposure to abortion or placenta materials. But there has been some evidence that rams can excrete the Campylobacter in their semen. So there is a potential that there can be some transmission of Campylobacter. And since it is a zoonotic issue, or so causes disease in people, certainly something that we want to be aware of as to not have in our flocks. Chlamydia, so this is a bacteria that causes the epizootic abortion in sheep. And again, typically is associated with animals being exposed to abortion and their products. Research has indicated that that we can, infect semen or have infected semen with chlamydia and place it into the vaginal vault of ewes and actually cause disease transmission. But as far as it actually occurring in our flock type situation, pretty rare. I can't even think of a situation where that can occur, but it is, a potential. So, something that may show up there, again, very, very rare. Brucella ovis and the Brucella melitensis. So the Brucella ovis is concerned in sheep and the melitensis in goats. So the Brucella ovis in our sheep generally is the main problem we're going to see with it, is causing the epididymitis that we see in this ram over here. So generally, a ram would get infected by breeding an infected ewe, and the disease tends to be subclinical in our ewes, so we wouldn't necessarily know that she had it. And so then the ram gets infected, and then he can go on and infect others. Brucella ovis is a regulatory test that we do. We take blood from rams if we're going to be shipping them out of state. So it is something that we keep an eye on. And so if you are purchasing rams, because sometimes it's not evident that they have epididymitis, so certainly doing blood titer tests on these animals before you bring them into your flock, definitely a strong recommendation. On the case of the Brucella melitensis in our goats, I just mentioned that it's more of similar to Brucella abortus in cattle, in where the transmission is going to be more through abortion products and this type of thing. But again, it's one of those zoonotic diseases, and so people being able to be exposed and get sick from it, we want to be excuse me, aware of that. And there is it's not for sure that that can't be transmitted, but again, one of those we want to keep out of our flocks and herds. And then ORF and other pox viruses, there has been some evidence that this has been transmitted, and generally it's more of a opportunistic type of situation where, say, we might have a lamb that is, showing evidence of the pox, and so of course they're nursing, or they're, they chew and they're on the vulva area of their mom, and in so doing then can transmit some of the virus and cause a bit of a pustular problem. And then if that goes unnoticed, and then when the ram goes to breed that ewe, there is potential for transmission of this pox virus from the ewe to the ram, and then potentially spread that way. Also, there's been some correlation between the ORF pox virus and pizzle rot that we can see with our males, which is associated with a crinibacteria. So again, it's kind of, again, a rare thing, but we can sometimes see that. So another good indication to be aware of what ORF looks like, and this is typical, and even in some cases not quite as advanced as this. There is a vaccine for it. It is a zoonotic disease. So if you suspect that, you may want to get some diagnostics to know you do or don't have it, and then potentially institute a vaccine program. So that pretty much takes care of the somewhat sexually transmitted diseases in our sheep. So we'll move on to the culling considerations. And again, most of what we deal with out at the Sheep Center here at the U of I has to do with mammary issues. And I generally, most of my, the culling considerations that get brought to my attention are going to be more health related. Dr. Suber did a great job talking about, some considerations. Obviously, if wool is one of your main goals in your production system, that would certainly be, another consideration for culling prior to breeding. But in this case, we'll be, kind of focusing more on health related issues that I think can generally affect a lot of our producers, regardless of what their goals are. So on the mammary issues, looking at the mastitis issue, mammary trauma. And we'll talk a little bit about mammary conformation. Again, Dr. Suber talked with about that as well. And that certainly should be an important consideration for your breeding animals. And then milking ability, and how we can actually assess how well some of these ewes are doing with their milking ability. So mastitis. So mastitis can, be a multifactorial disease. Generally, it's going to be caused by, injuries, viral, bacterial infections, bacteria being most common. And then we have the situation where we can see clinical, where we actually see issues associated with mastitis, poor looking milk, inflamed udders, they're sore, they're heat, etc. And then some of them are subclinical, where we're not seeing a whole lot of signs associated with that. The biggest thing I can say, is prevention. And if we can identify these mastitis cases really early on and get treatment for them, then you can have a high percentage of turning these acute mastitis cases around and actually taking care of them, curing them. Then they don't become chronic mastitis, where we have a lot of fibrous development. And again, generally those animals are going to be the ones you're not going to want to keep in your breeding flock. So, being able to, identify these, I know, again, at the Sheep Center, that's been one of the big things that we've instituted, and that has greatly reduced the number of ewes we've had to cull from because of chronic mastitis issues. Another thing too, mastitis, at weaning time. So we're taking the lambs away. If you can, what we do up at the Sheep Center, withhold water for 24 hours. And then if you can reduce the protein level of their diet, that can aid in reducing some of the post-weaning mastitis issues that can occur in our ewes. Mammary trauma, yeah. So that was one of the reasons for this picture here is, so one of the main reasons we see trauma is because of the little snaggle teeth that sometimes occur in the lambs. And so if you do see something like that, make sure you're taking a look at those lambs, looking at those teeth. And if they do have a snaggle tooth, get your little nippers out and cut those teeth back. And that can help prevent this, as well as not allow it to keep on causing issues. So mammary conformation. So I actually have an undergrad student that we're looking at, going to do a study this coming spring during lambing season, looking at mammary conformation and seeing if there's any correlation to weaning weights in lambs as they're growing. But one of the things that definitely, if you're seeing ewes that have these teats that are sticking out to the side like this, it makes it very difficult for the lamb to grab hold of. And so it's usually taking a lot more time and energy to try and get those lambs to latch on. And we've had a couple of ewes with that type of conformation where we just ended up having to bum the lambs, and consequently, we did cull the ewes just based on that type of conformation. Some of the other conformations that we see over here, we may associate with certain type of damage or chronic mastitis kind of issues. And again, if you're palpating these udders and you're seeing a lot of or feeling a lot of fibrous tissue, they're not uniform side to side, those are going to be candidates that you really should consider for removing from your flock, because they're just not going to be able to produce adequate milk. The other thing that we've run into is some of these ewes that have huge nipples, and so then when the bag is engorged at the time of parturition, those nipples are so big that the lambs cannot even get their mouths around them. And so that may be another consideration for culling a ewe. And then, as Dr. Suber mentioned, those supernumerary teats, if they're in an area where it's not likely that the lamb is going to latch on, I usually ignore them. I don't really worry about removing them either. But definitely if they're in the area close to the normal teat, then you're going to have problems with them, and that's not something you want to have to deal with. Milking ability. So there are, if you're a member of NSIP and you're getting some of these metrics, you can utilize some of those metrics to actually give you an idea on a couple of parameters on the maternal side of things. And one of these is the maternal birth weight. And basically this number is, or this index is giving you an idea of what was the uterine environment like within that ewe to, perpetuate hopefully a well-formed, healthy neonate. And so that they're, that they're going to go on and prosper. So, birth weight is part of this equation. And so it gives us an idea of these, what was the uterine environment like, stillbirths, again, low birth weights, those kind of things can be an indication that the uterine environment wasn't very good. And if there's not a lot of underlying reasons for that, you may want to consider not keeping that particular ewe in your flock, because it's a good chance that that's going to go forward. Weaning weight. So weaning weight is, and the maternal weaning weight, what this is basically estimating is the mothering ability, or basically milk production from birth to weaning. So how well did she do? How well did her lambs, grow based on her milk production? So both of these metrics could be things that you could keep track of, and can be a good measure for keeping ewes, or deciding to cull if especially if those metrics are reducing. Okay, so then just moving on to just kind of general health considerations. So I think every year prior to the breeding season, you should be bringing all your ewes through your race system, and getting a good look at them, putting your hands on them, assessing what their body condition score is. And I apologize, that should be BCS, not BSE. What are they too thin? Are they too fat? The other thing is looking at their teeth. Are we seeing basically a good mouth, incisors here? It's also nice to even take a look at and get a feel for molars and how they're doing that way, especially if we're talking about range flocks. If we're seeing, teeth where we're seeing a lot of incisors missing, and this can occur in animals that are fairly young. So, if this is what you're seeing in a, a 2 or 3 year old, I would definitely not consider keeping her in the flock, because you're going to have, she's just not going to be able to masticate her food well. And then of course, these other problems, again, most of these are picked up in these animals that are pretty young, but I have seen, 2 and 3 year olds that, not to this extent, but have some issues. And again, even if it's not affecting them as far as their ability to masticate food and maintain weight, it isn't something that you want being passed on to offspring. So the parasites, so we are looking at or understanding that there is some genetic components to resistance ability in our sheep, and resistance against parasites. So, and the fact that we are running up against a lot of our dewormers not having as much effect on parasites as we would like, I think this is a good opportunity to also, be able to evaluate that. And I know NSIP does some of those metrics as well. But just even on your own, utilizing, we can do, fecal floats. Those basically just are a screening test for what parasites are there or not there. The actual numbers are going to be done more with like a McMaster's, and I think the fecal egg count is a really good way of evaluating where our animals are at, and how your deworming program is, and even giving you an idea whether you have these animals have more natural immunity against these parasites. So, keeping animals in your flock that are showing more resistance to parasites, and maybe culling some of those that are not. Body condition score. So I tend to like to see my ewes roughly around a 2.5, just as they're going, into the breeding season, and I try to strive for that area. If you've got one that's, below a 2, below a 1, you need to figure out what's going on with them. If you feel that they are valued, to try to keep them. Otherwise, I would just, if for no other reason, if they're just not keeping up, then that may be a reason for culling them as well. Prolapses. So I've got a picture there of a vaginal prolapse, uterine prolapse, and rectal prolapse. And generally, the vaginal prolapses and the rectal prolapses will tend to see late-term pregnancies where there's a lot of pressure in the abdomen. And so, and especially if they're maybe on a little bit of dry feed and they're coughing, just that, the pressure can cause those tissues to pop out. In our, vaginal prolapses, just the hormones that are going or raging around at this time too, we can see increases, proliferation of tissue. So those, again, vaginal prolapses and rectal prolapses, we tend to go ahead and cull our animals if they have that problem. I think it could be argued, either way. Uterine prolapses, if that happens, those animals are definitely going to go down the road. One, if you can, get them returned to at least serviceability, so that, and the lambs were alive and they can, raise the lambs, that's great. But, once this has happened one time, the chance of it occurring is great. And so the uterine prolapses are definitely automatic culls. One of the things we've been seeing in our animals this year is actually our young stock with rectal prolapses. And we also do fairly, we have short tail cuts on some of these animals, but not all of the short tail cuts are ones that are prolapsing. So we are looking at this. We're looking at the dams. We're kind of watching this to see whether that's going to be an issue that may cause us to think a little stronger about culling some of the dams from the offspring that are having some of these rectal prolapses. A couple of diseases. So OPP. Again, this is a viral disease that typically is going to cause usually subclinical signs in our animals. It's spread through the colostrum. So it is something that if you have it in your flock, you would like to get rid of it. And so identifying the animals that have it can be challenging. So, but it does cause, especially it's going to lead to a chronic mastitis issue. Eventually these animals can develop respiratory signs, clinical signs, which is another, aside from passing it on to their young through the milk, they can also pass it through respiratory excretions. So, and then the caseous lymphadenitis, these animals that have these abscesses. And again, this is something that is just, if you want it out of your flock, if you want it out quickly, essentially, testing and or culling animals that show any kind of these abscesses are a way to quickly get rid of those diseases. And then on the side of the ram, again, we should be giving them physicals every year. It's a good time to, at that same time, doing a breeding soundness exam, evaluating their semen, as well as evaluating their external reproductive tract, and make sure that we're not seeing any sign of epididymitis. Doing a body condition score, doing a fecal on them, checking their teeth. Conformation issues, most poor conformation issues should be picked up pretty early in our rams, but occasionally I've seen rams that as they're getting older, they're starting to develop some arthritic issues in the hocks, and or a little bit of hump in their back that might indicate a little bit of spondylosis in the back. And again, if those kinds of things are causing them pain, they're not going to do well as far as a breeding animal. And so, so those things should be evaluated and then consider, culling the ram with those considerations. And then lastly, on the biosecurity, as I tell my students, most of the issues walk through the gate. And what I mean by that is people bringing in animals from the outside and not having them tested for some of these more common types of things that we've talked about, you know, CL, OPP, cases, I said that, brucellosis. And so you bring them in, and then, you know, you end up having a train wreck, because then they spread it to the rest of your animals. So that's always, you know who you're getting your animals from. And then, you know, just some common things. It makes sense to do good biosecurity, because your healthy animals are going to be more productive. They're going to, you're not going to have welfare issues that, you know, in this day and age, unfortunately, people are always ready with a camera. And so, you know, we want to be good stewards and be taking good care of our animals. And that it also, you know, will bottom line increase your efficiency and profitability as a farmer producer. So some of the things that you can consider before adding animals to your flock would be, you know the health status of your source flock. You know, ask them, you know, how often are you testing for, you know, these diseases or that disease? If they are not really doing much, then before you ever bring, you know, an animal on your place, get it tested. And then, you know, once the test comes back, they're all negative, you bring it to your place, you still quarantine that animal for, you know, 2 to 3 weeks to make sure that there's no issues of disease. At that time, it's a good time to look at parasite load and take care of that if there's a concern. Again, trying to minimize the number of source flocks that you have. And or if you can, you know, maintain closed flocks. But, you know, in the advent of artificial insemination and more of that being done, you know, there's a potential for not needing to necessarily bring rams in, but you know, at some point you're probably going to have to be bringing in some outside animals. So just do it with care and consideration of your biosecurity. And I think that is it. So can entertain any questions.
All right, thank you so much. You do have a few questions. Let's start at the beginning, I guess. Do you can you expand on some of the tissue samples that you might need to test for B. ovis?
So basically, the B. ovis is a titer test. So we would pull blood, and that's going to test the titers. If you were actually concerned, like if you had a ram that had epididymitis, you could biopsy and send those in. You might get a result back, and you might not. Oftentimes it's not that rewarding. We tend to just get a lot of scarring, this type of thing that comes back associated with that. But it is one of the more common reasons why we see that in our rams. But so those would be, you know, the two potential, but definitely the titers is usually the gold standard for identifying that. Okay.
There was a number of questions related to the mastitis, and you had talked about taking them down in their protein content and taking them off of food and water for a couple days. Can you kind of expand on the mechanism of how that works to decrease mastitis?
So basically what you're trying to do is just it's gonna, so when you have the lamb quits nursing, and so that's going to be a buildup of milk then within the udder. And so by removing the water for a few days, that will help to reduce some of the just kind of the fluid content associated with that. So we don't, you know, I don't recommend more than 24 hours. And then reducing the protein is just going to help to essentially back the nutritional level at the physiological level of milk production, just because of the fact that they're on a lower plane of nutrition. And so that's basically what we're talking about there.
Okay. Somewhat related to each other, there was a question about whether you have a recommendation on the type of injectable antibiotic when treating mastitis, and then also whether you have any thoughts on the vaccine against Staph aureus.
I don't have any experience using the vaccine against the Staph aureus, so I can't really speak to that. Generally, unless my, unless there's a reason to, I'm oftentimes just treating the mastitis locally using basically the dry cow or lactation mastitis treatment for cattle, just essentially giving a half dose. Now you have to remember this is all off label, so you need to be working with your veterinarian on that. If there's indication that we have some systemic issues going on with that, my tendency to is I'm a big fan of penicillin, or my second would be Ceftiofur or the XNL.